So when it comes to pharmacies, there are so many myths surrounding them. For example, generic drugs. Are they just as okay as the other thing? Perhaps. Maybe so, maybe not. We're going to get to the bottom of it. I'm pleased to say that I'm joined during this segment by Dr. Sue Ojigir. She is an award-winning pharmacist, an advocate, author, and mom of five. By the way, she is dubbed social media's favorite pharmacist, and she joins us right here on the Live Zone. Dr. Ojigir, truly a pleasure to meet you, ma'am. Thank you so much for coming on the show.
It's a pleasure to be here. Thank you for having me on.
You heard me touch on it, and that is generic drugs. So many folks have so many questions when they walk into the pharmacy. And I got to be honest with you, I don't think folks think about it until they are presented with having to do just that. So when it comes to myths, what are some of the things that, well, we should really just put to the wayside?
That is a common question I always get with our generic medications compared to our brand name medications. And quite contrary, when you think about exactly what the difference is, there is really no true difference. In fact, generic medications have the same active ingredients as our brand name medications. So the differences are, and the excipients are the fillers that are in these medications. And that's truly the only difference between the two of them.
Let's talk about, let's say, herbal and natural drugs. Nowadays, in 2024, that's the way to go. Everybody says it's the best way to go. It's safe. However, some folks say that's not actually the case. I would assume you happen to be one of them, ma'am. Am I correct?
Correct. So the quite a large misconception is all medications are safe, particularly our herbal substances and our vitamins that are available over the counter. I mean, it's readily available. It's easy at our convenience to purchase. So we have that common misconception that they're always going to be safe. What we're forgetting is that we're also taking certain medications and they can have interactions with our current therapy. And a big one would be like our blood thinners, warfarin. There's a huge interaction with a bleeding risk that you always want to make sure that you consult with your pharmacist before beginning any medications over the counter.
Yeah, I got to tell you, full disclosure, recently I had somewhat of a little toothache, somewhat of a little infection, had to go to the doctor. The doctor prescribed antibiotics. I started taking them, and lo and behold, I felt great. However, he said that I needed to finish all of the antibiotics. I think so many folks fall in the position that I happen to be in and say, you know what, I'm fine, don't need to finish it. What say you, ma'am?
Perfect point. Next myth that's quite common, you start feeling better, so you stop taking your medications. And especially true with antibiotics, what that happens is the bacteria starts to build resistance and it becomes stronger and harder to fight and get rid of. So you definitely need to finish your antibiotic course. And also with maintenance medications, blood pressure medications, diabetes, cholesterol medications, it's a little bit harder to gauge if these are actually working. So you want to continue, and before you stop taking anything, make sure you check in with your pharmacist and your physician.
All right, so it's no secret. Obviously, it's Friday. Cheers to the weekend, which means a lot of folks might want to take part by drinking an alcoholic beverage. Is that necessarily the safest thing to do if you happen to be on medication, even if that little bottle says it's okay to drink alcohol?
The best response would be to always be cautious. To be on the safe side, avoid alcohol while you're taking medications. And there are some medications that have a very detrimental side effect and could make you very sick if you do combine the two of them. So you want to steer clear from that.
So a lot of moms and dads happen to be watching right now, and they're saying, you know what, when it comes to little Billy or little Becky, they're concerned about their health as well, specifically surrounding medications. Should mom and dad give their children, let's say, smaller medications because, well, the kids are a lot smaller as well?
I wish that could be true for all medications, but you always want to make sure you're giving the right recommended dosing because they have specific dosing that are only for children, and some children require larger doses than adults. So never do the guesswork. Always check with your physician and make sure you're giving the right dosage and use the right dispenser to make sure you're giving the right dose as well.
All right, I figured we'd end with the most important question of all, and that's the question that everybody wants to know, and that is, how in the heck are you doing this as a mom of five, ma'am?
Well, I would say I get a lot of practice from being a mom of five. The kids give me inspiration. Take one day at a time and be sure to you have to enjoy what you do. And I love being a pharmacist. I love creating content for my viewers online and just being the face of pharmacy. So I really enjoy it.
And that's why you are social media's favorite pharmacist. Once again, we have been speaking with Dr. Sue Ojigir, kind enough to join us right here on the Live Zone. Truly a pleasure to meet you, ma'am. Enjoy your weekend.
Thank you. You as well.
All right, guys, we'll take a quick break and we'll be right back.